For more on this now, let's bring in Dr. Susanna Hills. She is a pediatric airway surgeon and assistant professor of ENT at New York Presbyterian Columbia University. Thank you so much for joining us. So let's get into some of the headlines that we've been seeing. There's a study came out earlier this week that suggested that one vaccine dose could be enough for people who had already tested positive for COVID. They already had COVID, they recovered, so maybe they don't need 2 doses of the vaccine. Can you give us a little more information on that and your take on it?
Absolutely. Yeah, this is a really exciting study. When you think about the fact that maybe as many as 100 million Americans have already been infected with COVID-19, and maybe those millions of Americans may not need 2 doses, this could be a huge game changer in terms of vaccine availability at a time when we're really crunched for vaccine doses. It's the supply right now that is our major challenge. This was a study that came out of Mount Sinai, and it was published in the British Medical Journal. And it tested the serum of patients who had COVID-19 after a single dose of vaccine. So they got COVID-19, they got a dose of the vaccine. And what they found was their antibody response was comparable to, or maybe even better than folks who had received both doses of vaccine. So it's a really interesting study. What we don't know about this is how long or the durability of the immune response when the immune response is induced to getting COVID-19 or to getting the vaccine. So how long this added effect or this benefit from having had COVID-19 will last is yet to be determined, but really exciting possibly.
So let me ask you about this. While there is a chance that a single dose will do the trick for people who've been previously infected with COVID-19, there are new concerns that reinfection is not as rare as once thought. Our Boston station reports that out of 2,000 young, healthy Marine Corps recruits, almost a fifth fell ill again from the virus. So it's important to note that the study hasn't been peer-reviewed, but what does that mean for the pandemic moving forward?
Yeah, Vlad, this is one of the questions we've really been trying to answer. Can people who've gotten COVID-19 or who've tested positive still be carriers? And what we've suspected and what we're now finding from data like this is that, yes, it does appear that people who've been infected can still go on and continue to be transmitters of the virus. This group of Marine Corps was about 2,000 people, and their data is based on COVID testing, nasal swabs. And I think it just drives home the point that if you've had COVID-19, if you've been sick, that does not mean that you can't be spreading this virus. And it means that even people who've been sick with the disease, potentially people who've even been vaccinated are still transmitters. And everybody's got to absolutely commit. Everybody, no one is free from this commitment to wear masks and socially distance and wash hands and do all those public health measures that we know are going to be so critical in protecting our communities.
So throughout this whole pandemic,
I'm sorry, my bad.
I was going to say, throughout the pandemic, Doctor, we have noticed that, the UK has been a little further ahead of us when it came to approving vaccines. So now we're hearing more and more positive news about the AstraZeneca vaccine out of the UK, which is good, not only about its effectiveness to, protect us from the virus, but also its effectiveness when it comes to spreading the virus once you have received the vaccine. So that sounds good. But it doesn't look like this version of the vaccine is going to be approved here imminently. So why is it taking so long to get the approval here in the U.S.?
Well, there's a very long approval process for every medication, every vaccine. They all have to travel through the FDA, and they're scrutinized really closely because, our first commitment before we administer any medication, including vaccines, is to make sure we're doing something that's safe. And that way, everybody who gets a vaccine can also know what they're getting is safe. So there's a vetting process in the UK. Vaccines also have to go through an additional vetting process here in the United States. And it looks like, as wonderful as this vaccine is, it may not be available here in the US until April. Fortunately, at the same time, we've got our vaccine from Johnson & Johnson that is very possibly going to be approved by the FDA later this month. So that also will be another single dose option in our armament of tools that we could potentially be giving to people right now. I just want to again stress that, yes, the more vaccines we have, the better, absolutely, in order to get people covered and to get people protected from the virus. But while we're waiting for these vaccines, we're still able to protect ourselves. We're not helpless against this vaccine. Those public health measures that I just mentioned are going to be extremely effective. They're perhaps the most effective tool we have while we're waiting for vaccines like this one from AstraZeneca.
And doctor, we should just underscore, I think that we perhaps journalists in the media have not done enough to just sort of sometimes sit back and realize what we've accomplished around the world in getting these vaccines from an infection that none of us who were not doctors, had any idea about at this time last year, or were barely beginning to understand it, to the point where we are today, less than a year later, in having numerous vaccines that are available, and all of the 5 vaccines have eliminated COVID-19 deaths, right? I mean, they've essentially, anybody who's received this vaccine has not died from COVID-19, and they've also drastically reduced hospitalizations. I mean, we should just sort of sit back and appreciate the scientific achievement the entire world has recognized or achieved, because I don't think we've ever seen anything like this in history.
You're absolutely right, Vlad. It's amazing. We've not seen anything like this in history. We've not seen a pandemic of this extent in modern times, certainly not in the United States, that's had this kind of devastating effect. And yet the response with developing all these vaccines has been astounding. And what an accomplishment for the scientific community. It's amazing. And I especially appreciate the point you just made about it being really a global effort. Countries across the world are contributing to this vaccine effort with tremendous success. And that really just points to the fact that this is a global pandemic. It's demanding a global effort, and the entire world is contributing to this process. Russia, China, the United States, Europe, all across the board, there are significant contributors to fighting this pandemic. And as a global community, we're really going to, I think, be able to get a hold of this, but we've got to keep in mind that it's a global effort, and none of us is safe, right, until every single one of us is safe. What an achievement, though, on a global scale.
Yeah, no doubt. And I mean, I sometimes think that, when we get into the details, we often find incidences of, adverse reactions, or, we're talking a lot about folks that are reluctant to take the vaccine. But I sometimes feel it's important to just sort of hit that note that we've achieved something here around the world. It's not just the United States, as you say, doctor. It's all these other countries that have come together to develop these 5 vaccines, and that is just on the face of it alone a remarkable achievement that we should be celebrating. And hopefully, we will all receive the vaccine and not have to worry about this in a year or so. Dr. Susanna Hills, thank you so much. We appreciate it.
You bet.